Namaskar, this is Ankita Apte, and today we are honored to have with us Padma Shri Dr Armida Fernandez. Ma'am, welcome.
Thank you, Ankita.
We are so honored to have you.
My pleasure, Ankita.
So, instead of me introducing you to our listeners, let's begin our conversation so that they can get to know more about you from yourself, shall we?
Sure.
Okay, so let's begin at the beginning. Ma'am, what was your first reaction when you learned that the Padma Shri has been conferred upon you?
I think my first reaction was really I was in shock. I said, oh my God, I've actually got a Padma Shri. Then I thought to myself, I said, my God, what an honor to get a Padma Shri at a national level. I've got many awards, but at a national level, the country, I really felt honored. And then after some time, I thought about it and I said, oh, I've got the Padma Shri for all that I've done over the years, but did I really deserve it? Because whatever I did, like starting work in Sion Hospital with the milk bank, with the newborns, or later working across the slum communities in Mumbai and elsewhere through Sneha, or even the palliative care I started, I could have never done it alone. I was blessed with the best of teams, my department at Sion, the teams at Sneha and palliative care. We all worked together for what we have done and achieved. And therefore, this Padma Shri is really to be shared by all those who worked with me. I think that's the feeling I'm most comfortable with at the moment.
Yeah. So, tell us about your childhood. How was your home like? What was your family like? And how was your schooling? How were those days?
I'll tell you, I had the happiest childhood any child could dream of. See, I was born and brought up in this lovely little, township, I would say, called Dharwad.
It's a beautiful town.
I know. And you know what? Dharwad was really a university town with only colleges. There were no factories, there were no industries, there was no smoke. Just, there were flowers and butterflies and birds and trees. I tell you, it was heavenly. And my father was the professor, then principal, and he was English literature. And I'm the youngest, he's Armando Menezes, and I'm the youngest of 7 children. So that too, after 5 boys. So, financially, of course, I'm sure my parents struggled. Salary, even in those days, was a pittance, maybe 300 or 500, I don't know.
Oh my God.
Probably 3. 7 children. So, you know what? We never had any luxury at all. Forget car. We didn't even own a bicycle. We didn't even have a radio in the house. We used to go to a neighbor's house to listen to, All India Radio or, the Ceylon. They used to have that show.
Yes.
We used to go to a neighbor's house. But the fun and joy of being there as a family. So we spent family time. We had our own band. We had our own cricket team and lovely friends. It was one big community in Dharwad. And I just loved it. I went to school called St. Joseph's School in Dharwad where I studied, then Karnataka College, and then I wanted to do medicine. My mother wasn't keen. She said, you can't go out. Then fortunately, there was a medical college at Hubli, Karnataka Medical College. And I tell you, I had also a wonderful time at Karnataka Medical College. We had excellent teachers. I know the difference now when you come to Mumbai, but there, teachers who stayed on the campus, teachers who came and took rounds morning and evening, teachers who were available at any time. It was a different world and lovely classmates. So I had a wonderful, happy childhood, wonderful parents, teachers, and of course, friends.
Yeah. Taking you a bit back, what inspired you to pursue medicine as your career?
I think even as a kid, even when I was 3, 4, I like to nurture, so if there was even something in the garden that was hurt, I would say how to save a little snail or something like that. If a butterfly was injured, my heart used to break. I said, oh my God, what can we do? What a bird. Animals too, I loved animals. So it always meant anything hurt, I want to see how to deal with it. So I think all my life, my tendency was to try and, see how that person is comfortable and things like that. And it was strange because 6 siblings in my family all took arts. But then I said, no, my heart is here and I want to do medicine. So as far as I can remember, the temperament of mine was always that trying to heal, and therefore I decided on medicine.
Okay. And then you came to Mumbai.
Yes.
What was that journey like?
It was not easy. When I came to Mumbai, I came to a different world
Yes.
altogether. Now I know what people go through. Even today, when students have to come to do their graduation or post-graduation, I feel with them. Because it's a cultural shock. A city is a cultural shock. Mumbai is an additional bustling with people, and people really don't have time for you one. And even the people around you, when I joined the hospitals and all, they were surprised that I could even speak English because I came from Karnataka, wondering which part I came from. So the attitude was different. It was not easy to adjust. But once I got used to it, then I got adjusted. And then there was a different style of teaching here. So the teachers were not like the ones I was used to in KMC Hubli. But then you get used to it. And it's a tough time, being a resident working 24/7, especially pediatrics, doing your MD at the same time is so tough. And the third additional which I added to my problems is I met my husband, and within a year of us meeting, when we were both residents, he was doing dermatology, I was doing pediatrics, we got married. So the three things together, but it had its ups and downs, but that's how life was when I first started in Mumbai.
Yeah. And then you joined Sion Hospital.
That was, when I shifted from KM, Sion was a paradise, and I think that same feeling of, the Department of Pediatrics at Sion Hospital was like a family.
Oh.
The head of the unit was Dr. Armida, and all the people, we were all so close. The whole attitude and all, it was more like, I was so much at home and very happy. And I think what difference it made is, what if I felt strongly about and I wanted to do, I got total encouragement.
Lovely.
And that's something I think teachers and heads of the department should learn, is that, let people dream, help them, to realize those dreams instead of saying, no, these are rules, these are regulations, you can't do this, that and the other. So I think that was the environment I was in Sion Hospital. It helped me a lot.
So, while working at Sion Hospital, what did you observe about infant mortality and how did you address that issue?
So, when I went to Sion Hospital, I had done my MD Pediatrics. And so, when I joined the Department of Pediatrics, I realized that the sick babies that came to the premature unit and the sick unit in Sion, the death rates were embarrassingly high.
Oh.
Babies came, many of them. I must say that Sion was different because there were some 10,000 deliveries and so many babies transferred there.
Good Lord.
And Sion, the dying and the desperate are sent to hospitals like Sion, multiple, totally free. So, they were the poorest and they came late. So there were many reasons. But when I saw these, I told my head of the, sir, babies are dying, the newborns and all. So he turned around to me and said, why don't you do something about it? And at that moment, when he said, why don't you do something, I think I shifted from being pediatrician to a neonatologist. I didn't have a degree. I didn't have, I had not studied as such. It was actually, neonatology wasn't so, started in a big way here. But I said, this is what and from that time onwards, I had only one mission, is how to reduce mortality of babies. And then I tried and find what are the causes of mortality. And I found there are many causes, but one of the major, the other causes was infection. Then I moved out to find out why, where did they get the infection from? Found out from the incubators, they were full of bacteria, difficult to clean, not enough staff, had to get rid of them. Then I saw that formula feeds, animal, bottled milks gave rise to diarrhea, then sepsis. I had to get rid of it. And then I had to think of low-cost measures to ensure that infection didn't happen and we could survive, because at that time there was not much finances funding into coming. So I couldn't get new incubators, I couldn't get. So all these ideas that I did in Sion Hospital neonatology on keeping the babies warm, the different methods I used were all low cost, could be done anywhere in the country. The second is I used exclusive breast milk. Very early. Now the whole world is talking, but before that happened, I'm talking of the, early 80s where I was pushing only human milk. Third is because we didn't have enough staff, no nurses, I changed it. I said, I'll make every mother come into the unit, and every mother came. So I said, I've got one nurse to one baby, and nothing like a mother, a nurse. And things that I did, today is so much research has been done
Yes.
and accepted. For example, mothers came in and kept the babies on the chest to say, you must live, you must live. Today there's so much on kangaroo mother care.
Yes.
The second is I put the babies to breast, however small, and doctors were saying they might aspirate, they're not big enough. I said, I'm giving them tuitions because then they have to go home soon. And today there's a lot of work on non-nutritive suckling going on.
Yes.
And then finally I said, I need a scientific method, because getting milk, expressing it, keeping in the fridge, one mother to another baby, I said it's not scientific, especially in a medical college. So finally, the idea for human milk bank, and I started then the first human milk bank in Asia, and people thought I was absolutely crazy.
Yes.
But again, I had support of my head of the department and the institution, the dean, and their support. That's why I could start. Many people might have had ideas, may not have been supported. So I was fortunate to have that.
Tell us more about this journey of establishing the first human milk bank.
So, I'd gone actually on a senior Commonwealth fellowship to UK. And there in Oxford, I saw for the first time a human milk bank.
Okay.
I said, oh my God, that's what we can start here in Sion Hospital. But then there were, first of all, you have to get space.
Yes.
Secondly, funds. When nothing like that in the whole of the country and nothing in municipal corporation, who's willing to give you
that
money?
fund.
So I had to look for a donor. And fortunately, my brother was working at the Taj, and he talked to the person in charge of Taj, and he said, okay, I'll fund you. And also he was wise enough to say not only fund to establish it, but staff for 3 years, so then the municipal corporation. So that was his wisdom. I didn't realize it would be tough. And then I had lots of problems because most people didn't believe in it. Actually, even pediatricians. They were saying, what is this? How can you do it? And of course, for non-pediatricians, it was even worse. When I had to get staff from the municipal corporation, said, how can you give one mother's milk to another mother? So I said, we are giving one species milk to another species. But he wasn't convinced. Finally, God inspired me. I said, but who fed Krishna? He was, wet nurse. Then suddenly that realization, yes, it has been done in our country over years, wet nursing. So then finally they got convinced. Before funds got over, the corporation gave the staff, and then I could continue the human milk. And what happened as a result? It took a long time for the rest of the world to get on board. And even I think I started at Sion, then someone who left from Sion, Dr. Ruchi Nanavati, she started at KEM, and slowly, but it took years.
Yes.
And today, of course, the whole country is starting human milk bank. It's just such a craze. But it's been a long journey for people. And whatever, now so much research to say.
Yes.
There's research to say that how little human milk given to babies, the premature and sick, can help survival, reduce mortality rates. And I'd done it many, many years ago.
So what advice would you like to give, to expectant and new mothers, especially about breast milk? And
so, I've been working on breastfeeding for years, Suna. And I think that I want to tell expectant mothers that breast milk is amrut, nectar for the baby. And God has provided everything a baby needs, not only for survival, prevention of infection, growth, immunity, all that in human milk. That's the first thing, and that's easy for mothers to say, okay, I must breastfeed. The second thing, we must give them that courage, and we have to tell them, we have to be there for them, and start in the antenatal period. Every mother can breastfeed. Yes, you can have problems, but you can overcome the problems. So that is important to teach the mothers. The third is that today, because many mothers are working, many mothers are under stress, and society itself, you have a mother-in-law and say, oh, child is not gaining weight, you better start top milk. Or someone else says, how thin, you're getting less weight. So these thoughts work on the mother's mind, and there decreases one of the hormones, oxytocin. So that itself is a problem for the mother. So support, breastfeeding support is so important. It is few rules that at the moment the baby is born, put the baby to the breast. That, breast, skin to skin contact should be there. Secondly, put the baby to the breast. The earlier, if we say in the first hour or two, the earlier the baby sucks, more the earlier the milk comes. Third, we have to tell mothers that don't worry. You get very little milk first. Drop, drop, drop. Don't worry. Because that much is your baby's stomach is so small, that's all that the baby needs. And others who are not so well educated, yellow milk, it's not pus.
Yes.
They used to throw it out in the past.
Yeah.
This is the best. It is so fortified, therefore it looks yellow. And that the quantity of milk will come up and down. Sometimes, what happens, if we use things like giving the baby a bath, keeping the baby open, fan, air-conditioned rooms, the calories are used up and the need for breast milk is more. So keep the baby next to you. No bath till breastfeeding is well established. I'm not saying don't clean the baby, remember.
Yeah.
No bath so that you don't lose calories and continue feeding breast milk for at least a year. Start other food by 6 months.
Yes.
Year, 2 years, as much as you can. So your baby will grow healthy. And like I said, not only prevent infections, there are growth factors, there's so many other factors. And even mental growth. They've shown the baby's IQ and all are better and helps the mother in preventing cancer and all. So the benefits are innumerable. But please, the hospitals, the family, the husband, everybody needs to support that mother.
So what inspired you to establish Sneha Foundation? You mentioned it earlier. And what does your life look like, post-retirement?
Okay, when I was still at Sion Hospital feeling very good, we brought down the mortality rates. And of course, we were training all people all over in the other hospitals in Mumbai. But then I found that, with the high, many babies did come for follow-up. And when I said, what happened to babies? Oh, they died at home. That happened. Second is, some of the babies, one of the major causes of death of babies was asphyxia, means baby didn't cry after birth. Why did they cry? Mothers came in very late. So the oxygen levels in the uterus only were less. So by the time the baby came, the baby was not breathing properly. They're asphyxia. So if they don't come on time or sometimes they had other problems, the mother had problems that are not treated, so they come in late. So if we had to, I told in that minute I became a neonatologist, I said if we have to save babies, then what we have to do, sitting in the hospital is not enough. You need to go where they live, into their homes, into their families, into their communities, to change behavior. Don't teach, Like teaching is different. You can do it to students who want exams and all.
Yes.
You have to change their behavior to say, yes, the moment you stop getting your periods, need to go for a checkup, register antenatally in time.
Yes.
Secondly, go for a regular follow-up because you can have so many problems that need attention. Third is that you have to go on time for your delivery and the high-risk factors that need to work. So that we can prevent, these asphyxias or infections or whatever happens through delay. So that is the reason I moved. The second reason, we not only in Sneha look after maternal newborn health and nutrition of the child, but we also look after violence. So why violence? When I was in the NICU, a 6-week baby, 6 weeks was raped and brought, and the baby didn't survive. And I was so upset. I said, what a crime, and where is that criminal? My mother was discharged in no time. We didn't know where she was. And I said, I wonder, was there any justice done? But I was in this big unit, so much work, so much teaching. That time I swore to God that when I retire, I'll work against violence against women. So across Sneha, we don't do maternal newborn health, child health, nutrition, adolescent health, and violence against women. So that's the whole spectrum we do.
You also mentioned about palliative care.
Yeah.
So please tell us about that also and the importance of it, basically.
Okay. What happened is that when I was halfway, in 2013, my daughter had cancer and she was being treated for cancer. But I lost her in 2013. And remember, my husband was a doctor. I was a doctor, both in medical institutions, students all over, best of oncologists. Still, we couldn't save her. So that's one thing. But she suffered. And with her, we suffered. And she finally died at home. But we watched her suffer and die. And we were suffering with her. And it's very difficult to deal with suffering. Yes. And my husband, of course, never recovered. But when I said I must find out what can we do about this suffering. And at that time I went and asked colleagues and all, and look at me, I'm a doctor working in neonatal. I had not heard about palliative care.
Oh.
So then I realized, I went to Tata's, found out what they're doing, and I said, we must work under SNEA, we'll work on palliative care as well. And that's how I started palliative care. And you know what happens is, and that is important to realize, when people hear palliative care, they get scared. Oh, cancer, end of life.
Yes.
No, that's not the fact. Palliative care is, we are trying to alleviate suffering of all life-limiting disease or serious diseases that limit your life. And what we want to do is, we want you to have a good quality of life. So, which are the diseases that we would choose? So, we'll talk about, cancer one.
Yes.
But stroke. If you get a paralyzed for life or both your legs are not working. What about Parkinson's, not cured?
Yeah.
You live for many years. Dementia. You have today chronic lung disease. You're breathless, you need oxygen, you can live for years. So chronic kidney disease or liver. So all these are chronic diseases that make your life and that of your family miserable. So we want to improve. You continue treatment, don't stop the treatment, your doctor treats, but an additional support for elevation of suffering. And now when you say, what is suffering actually? A pain. So don't worry, we'll give tablets, we'll give this, that.
Yes.
And now availability of morphine, which is a cheap thing, which is difficult to get. So we are thinking of physical, fever, you'll give something for fever or diarrhea. That's physical. But in these diseases, you don't have just physical. You also have mental pain. What depression, what anxiety, sometimes suicidal tendencies. Why this disease? I don't want to live. So that needs attention, and therefore you need a counselor together with a doctor. Then, and these patients say they come home, they have tube feeds, they can't take orally, tube feeds. They get bed sores because they are bedridden for so long. Some of the patients can have a tracheostomy, colostomy. All this is nursing care. So we have a nurse to look after the nursing issues. And then finally, especially in a country like this, besides the physical, mental, and you also have what is called social pain. I remember in COVID times when we were trying to reach morphine to some patient in severe pain, he said, Doctor, क्या दवा का क्या फायदा? खाने के लिए खाना नहीं घर पे.
My God.
I'm dying now. Who will look after my children's education? I don't have money to buy medicines. These, when you need oxygen, now we're giving them for oxygen, machines for oxygen, they cost a lot. Patients in our slums, where can they afford it? They can't afford that. And therefore you need someone for these social issues, you need someone to help out. And finally that spiritual pain. I'm such a good person, I did so much good. All the rascals, crooks are getting away with it. Why has God given me this disease?
Why me?
Yeah, that's right. So that's the patient. But palliative care looks not only after the patient. Who suffers as much, if not more, are the caregivers. So we're looking at the patient, the caregiver, throughout the disease. And when other medicines stop working, we continue palliative care. We are there at the time of the death so they can have a good, peaceful death and afterwards bereavement. And I think the important thing, another message is, we always take when a person is, even the older patient, 90 years, we rush to the hospital. That patient is on a ventilator, intensive care, you finished all your money, patient dies alone with nurses and all, everything beeping, tube in every orifice, and alone. So that when you know that cannot be, what survival risk, there's a risk and you won't survive, to have a peaceful death at home if they can. So you can be, so that's what another thing we say, make a living will. And otherwise, if it's the patient, how many mothers, fathers say, Mala gari resides, I want to die at home. And the people, relatives say, no, we can't take home. What will other people say? Please realize, we're not bothered. At home, peaceful, your people holding your hand, having, God's words told, whatever it is, you have that sort of a death. So that is a palliative care. I'm so glad that therefore now, from the newborn, antenatal, to the death, we do the whole life cycle in.
So, looking back at this illustrious journey, were there any moments or setback when you thought of giving up?
Never really.
Not even once?
Never ever once. You know why? Because I have, I think my biggest virtue is patience and perseverance. And my heart was telling me this is, from the, as far as I can remember, I wanted to do elevate. Actually now, elevate suffering is, I put because little butterflies, birds, even some millipede that was trodden on, I felt that.
Yes.
So that continued throughout, and whatever I went through with even my daughter's death, I felt, a healing comes over when you help other people in suffering. So, no, I don't think I ever felt, and I feel, that I think the most important thing we must realize that when we say, I have achieved, we have not achieved. God works through us, and He does that. So I'm a great believer. And I feel there's a path, for us that has been chosen, and we need to walk that path. So I never wanted to give up, and I've been blessed, I said, with so many good people who worked with me, and therefore I could do. And I will work as long. I'm a young person now, only 83, going to be 83, but I think till I can, I would love to work. God willing, I would like to do that.
So there must have been moments which were very difficult, you felt down, you felt defeated. So what made you keep going?
So you're right. I remember when my baby was born, 3 exchange transfusions, I thought she would die. 3rd, 4th, 5th day of life. I said, oh my God, will she live, will I die? But immediately I think what kept me going is, if I've been through this as a doctor, what will our mothers be suffering? My babies are dying. What I said, I have to be there for that. So what kept me going, even the death of my daughter, what kept me going is I need to do something about it. And I like I said, that belief that I'm here for a reason and I have to fill. So that, I think that kept me. And I must tell you that what kept me going, it's my husband. Because from day one, although we never had very much initially for survival, I worked in a municipal corporation all my life, never really earned well. But he was practicing a dermatologist. And when we had to pay loans, we had to do so much, we were struggling. Not once did he say, what are you doing there? You please join me and practice so we can earn and pay off our loans.
Yes.
So that support I got from him. And even my daughter, I remember I was giving at a talk in Sion Hospital. And again, training, I'm always training. And all municipal hospitals were coming to Sion. And my daughter had Hodgkin's when she was 16. And I was at a hospital and they were doing a biopsy.
Oh.
And she was 16. And early in the morning, the surgery was over. But she opened her eyes and she said, Mummy, what about your talk? Did you bring your slides?
Oh my God.
So I think if I look back, I got full support from the 2 people who I loved most, who said, whatever you're doing, you continue doing, we'll be there for you. So I think that's been my great, and God above.
So last question. What are your plans for the future? You are so young.
Yeah,
How
right?
does your future look like to you?
So I think I will continue doing what I've been doing. I think the government, I want to tell you that all along in all our work in Sneha and whatever we've done, palliative care, we've partnered with the municipal corporation and the government. So I think, that support we got is so important. And we must remember as NGOs, you can't do it alone.
Yes.
They are the ones who can take it to scale and ensure sustainability. So I think that I would like to do that, whatever we've got models that are good models in different maternal newborn health. I would like to still continue work with the corporation, with governments to take to scale. Whatever we've done, we are not going to do, share our models so that people can take it. So I think till the moment I can, and palliative care would be high in priority.
All I can say is wish you all the very best, and we are so proud of you.
Thank you so much.
Thank you for your time.
Okay,
Thank
then.
you.
Bye.